Hi, I'm Dr. Eleni Meletiadou, and I would like to thank you for this invitation to present my work at this conference. I will discuss a project I recently conducted. I explored female educational leaders' crisis management skills amidst the COVID-19 crisis and the reliance on inclusive leadership. Let me let me first provide a brief description of the study. So let me tell you that although 59% of graduates within the EU 28 are women, only 18% of female academics hold full professorship at universities, and even less become assistant professors according to the Netherlands Organization for Scientific Research. So aspiring female educational leaders' career advancement has been slow despite support provided by programs. For example, we have the Untitled Chapter, which tries to enhance women marginalization. So what we have been experiencing is basically male-friendly organizational practices which dominate higher education institutions, and women are not supported due to lack of programs which aim to develop their leadership skills. So although there is ample research for focusing on gender barriers for women in the academy, relatively little attention has been paid to whether women academics are really inclusive leaders amidst a major crisis like the COVID-19 pandemic. Basically, what this study contributes to the debate is how inclusive leadership can help universities face crisis effectively by shedding light on how inclusive female leaders who act as role models may improve organizational performance and, of course, increase employees' positive response when faced with crisis-induced challenges. So there are many issues that remain unanswered and are worth exploring in this crisis, in the crisis literature. This basically focuses on how to minimize the negative impact of crisis by leveraging it to the organization's advantage through consistent involvement of all stakeholders, for example, both leaders and followers at each stage of the crisis. So basically, what research indicates is that COVID-19 outcomes are systematically better in countries led by women due to the proactive and coordinated policy responses they adopt. In 360-degree assessments, women were rated by their colleagues as more effective. Also, previous research indicates that female leaders tend to perform better in a crisis in terms of overall leadership effectiveness because employees need leaders who are honest, truthful, and mindful of their colleagues' feelings and frustrations, can pivot new skills and focus on employee development even during major crises. So to sum up, the current study reports on how female educational leaders in higher education in the UK perceive themselves as leaders during major crises such as the COVID-19 pandemic. The main aim is to explore whether they confirm previous studies claiming that women are effective leaders in crisis and unfold how female education leaders in higher education institutions in the UK are facing the COVID-19 pandemic. So let me briefly refer to the methodology of the current study. So to explore female educational leaders' crisis management skills and reactions to the COVID-19 crisis and examine how inclusive leaders they really are, I interviewed 40 leaders from 4 higher education institutions in London, UK. What I used was opportunities and snowball sampling processes, as even a small number of women could provide reliable findings, since the current study had no funding, so there were time, money, and access constraints. So interviewees were found by tapping into my professional network. I interviewed female leaders that worked in publicly funded universities, and I started collecting data as soon as the COVID-19 crisis emerged. I chose a qualitative research design and conducted lengthy semi-structured interviews with senior education leaders, that is, senior lecturers, heads of division, members of the senior management team, generally women that had significant responsibilities, either teaching or research or administrative or all of them. So all interviews were conducted through MS Teams due to the COVID-19 restrictions, of course, and each interview lasted for approximately 50 minutes in length. In terms of data analysis, crucial parts of the interview were transcribed verbatim. The aim of the current study basically was to address the following research questions. How inclusive leaders are female education leaders in higher education institutions in the UK? How have female education leaders in higher education institutions in the UK reacted to the COVID-19 crisis? So as I said, qualitative research data was collected from non-standardized interviews, and it was analyzed using thematic content analysis. So the themes that the researcher that I tried to identify during the data analysis were closely linked to the theoretical background of inclusive leadership and crisis management, and of course they were also reflected in the questionnaire I used to interview the participants. So the aim was basically to determine whether the participants in the current study perceived that they were inclusive leaders, and also to explore the COVID-19 crisis management skills. And of course, this study yielded very rich data. So let me now discuss my central findings. So responding to these questions, to various questions that I used during the interviews, participants emphasized the importance of having a personal relationship with their followers, showing respect and consideration, which aligns perfectly with the core characteristics of inclusive leaders, as these were described in the literature. They offered support during the crisis when needed, as they were facing similar challenges. For example, they also had increased caring responsibilities. Some leaders also refer to the sensitive issue of showing appreciation and recognition and being fair at the same time. So their aim was to encourage their followers to continue contributing to the university goals in their own unique way, fostering a positive and supportive organizational culture in which they felt they belonged in line with the various theories, for example, that of human motivation. Those leaders stressed that they were available and easily accessible for their followers, offering support or advice if they faced any challenges. So the participants felt that team members had to feel psychologically safe to approach their leaders and share any concerns. More core values mentioned by the female leaders in this study included mentoring, coaching followers, sharing responsibilities, and encouraging participation. So through these initiatives, female leaders try to deal with experiences of bias, gender inequity, and challenges in their personal career trajectories, and also promote inclusion for their followers, irrespective of their background. So women leaders also avoided putting the blame on people, opted for finding solutions and remedies to problems and challenges. They were willing to assume responsibility for any mistakes, and chose to be diplomatic and discreet when dealing with their followers' mistakes. They tried to be fair and transparent, encouraging people in their teams and promoting them in every possible way, especially during the COVID-19 crisis. So our participants seemed to be inclusive leaders as they ensured that their employees were overall satisfied with their working conditions, in line with the theory of work adjustment, which claims that inclusive leaders develop an ideal working environment in which employees feel supported and therefore formulate suitable coping strategies when faced with a crisis. So basically, aspiring female leaders also turned to them for advice, because they were available and approachable, and always managed to find time for them. So in terms of crisis management, our findings indicated that these female educational leaders' response to the COVID-19 pandemic was dual, since leaders were asked to manage and lead simultaneously. They had to change the mode of delivery at a very short notice, promoting a proactive, crisis-prepared organizational culture, and support their members of staff, especially those who had caring responsibilities, minimizing the side effects of the COVID-19 trauma. So other leaders stressed the fact that they tried to find alternative ways to protect and support their team members, although some of them were particularly difficult sometimes to manage, increasing, of course, also their anxiety as leaders. So not everything run smoothly. Thinking long term was one also of the priorities for some of these leaders who were worried about the impact of the pandemic on the long term plans of their department and wanted to include this parameter in all conversations that they had with their colleagues. As true selfless leaders, they wanted to be present during the crisis and support their university and colleagues in every possible way, putting their personal and professional plans on hold until the pandemic was over. So these leaders had established guidelines to follow and often worked through crisis planning steps as part of their regular planning cycles. They believed that universities needed to adapt to different changes to ensure they supported students and staff, especially in terms of mental health. They believed that dealing with the crisis was a shared responsibility, so they involved everyone in the decision making and made sure everyone's opinion was heard and valued. Finally, they were also ready to make tough decisions to ensure sustainability for the university and well-being for various stakeholders. So to sum up, our findings suggest that female educational leaders demonstrate core characteristics of inclusive educational leadership and have good crisis management skills. So this study clearly indicates that they tend to reap the benefits of their diverse group members' contributions as they include them in the decision making and ensure their participation in overcoming various challenges universities face amidst unprecedented crises such as the COVID-19 pandemic. So our results, my results, clearly highlight the need to discuss how female education leaders can be supported to enhance their crisis management skills and possibly provide an example to their male counterparts in terms of how inclusive leaders can be the key to unlocking their group members' potential at the outbreak of a crisis that may threaten the viability of every learning organization and their employees' health and well-being. So inclusive leadership in universities should therefore be considered as a central pillar of the global response to crises like the COVID-19 pandemic. Let me now come to the final part of my presentation where I discuss the implications of this study and my recommendations. So taking into consideration the findings of this study, which indicates that female leaders still score low in terms of some aspects of inclusive leadership and crisis management, for example, perceiving themselves as inclusive and their own wishes for more support, I conclude that they should receive more training in inclusive leadership and crisis management skills, and they need to have the necessary resources to face unexpected situations. Therefore, genuine inclusive leadership interventions should be encouraged to trigger events that stimulate an important behavioral change in leadership style and include an explicit focus on ethical decision-making processes. Undeniably, leaders must use their authentic selves to promote an inclusive climate by role modeling inclusive behaviors for their followers, which is in line with the social information processing theory. So training of efforts should include large and small-scale incidents where senior leaders, both men and women, who are responsible for the coordination of services across units should be educated on protocols for crisis response. Universities should also sensitize and train senior leadership teams and HR professionals in universities on the gender dimensions of crisis and stress the importance of female education leaders' contribution to managing major crises such as the COVID-19 pandemic. So these training sessions should also help develop openness, availability, and accessibility as part of their organizational culture, as they will include, for example, meeting crucial everyday needs of the employees, improving the level of communication to ensure delivering valid, reliable messages in a comforting way, and the need to build a set of robust measures to emphasize mental health and psychosocial support. This aligns perfectly with the literature related to the benefits of inclusive leadership for an organization in traumatic events such as the COVID-19. Moreover, there are very significant insights for managers and human resource professionals. For example, the recruitment and selection process should focus on the identification of inclusive leaders based on the key features of self-awareness, relational transparency, balanced processing, and an internalized moral perspective. So I claim that inclusive leadership can be detected using survey-based methods, experiential exercises, and scenario-based exercises. For example, presenting an ethical dilemma to potential job candidates to assess their ethical decision-making abilities. Finally, I believe that universities should make continuous and systematic efforts to minimize inclusive leaders' uncertainty and anxiety by offering support and professional development sessions. Now let me close this presentation by referring to the advancements in gender equality internationally. I must say that these have been derailed by the COVID-19 pandemic. Consequently, advocating for more women as leaders and decision makers at all levels in university settings is important to adequately address the gender complexities of pandemics to better support vulnerable group members. So my study stresses theoretical underpinnings of the inclusive leadership style, which is characterized by supportive behavior towards employees. This inclusive environment with open behavior where leaders are accessible promotes psychological safety among followers. This in turn makes the employees more proactive, sharing, and helpful. Knowing that their leaders will support and actively listen to them in times of need helps reduce work-related stress. It is of utmost importance not just for employees but for students as well. The psychological well-being of higher education employees brings about benefits for the students because psychologically safe employees are less likely to make mistakes. It also reduces adverse events. So, for example, consequently, it is important to understand how a climate for inclusion can be institutionalized. This study revealed that the participating female educational leaders were inclusive leaders and were able to significantly influence the formation of a climate for inclusion. Inclusive leaders can help their group members understand the value of individual differences by using their elevated status to look for opportunities to support and encourage employees to apply their individual differences to improve work processes. So HR departments and university governing boards should consider taking these recommendations on board and try to implement as many of them as possible to foster gender equity, inclusive leadership, and effective crisis management. I would like to thank you for your attention, and I would like to point out at this point that I'll continue my research with female educational leaders after the COVID-19 pandemic, and I will collect their views and experiences now in the post-COVID era. I also think it's very important to explore the impact of COVID-19 on their well-being, and this is something that I'm currently doing in terms of the second phase of this research project. So I would like to thank you for your attention. Please don't hesitate to contact me if you have any questions or any concerns, or you would like to participate in this study. Thank you.